Hi everyone, thank you for joining. So we're gonna go ahead and get started because it's 11:50. And I just want to remind everyone that because we might not have enough time to get to everyone's questions, we encourage you to like questions that you see in the chat so we can make sure that we prioritize answering them. Okay. Good morning, Distinguished Academy of Biotechnology scholars, our Distinguished Academy of Biotechnology teachers, McKinley Tech Administration, and our distinguished guest speaker, Dr. Toyin Orunja. Here at McKinley, we strive to be the best students we can, and in turn, the best people we can as adults. Dr. Orunja is a prime example of someone who worked hard to be the best version of herself. Along the way, she was also able to help and inspire others. While coming up in the DMV, Dr. Orunja graduated from Eleanor Roosevelt, University of Maryland, and also University of Maryland School of Nursing, and was able to not only pursue her longtime dream of working in the STEM field, but also she got more experience through research and putting herself in a field of work to make sure it was the right path for her. Still, as a certified registered nurse anesthetist, Dr. Orunja is able to give back in her own way by being a mentor to the youth. Being such an inspiration and a pleasure to talk to, I'm honored to introduce our distinguished guest speaker, Dr. Toyin Orunja.
Can everyone hear me?
Yes.
Excellent. All right, good morning. My name is Dr. Toyin Orunja, and I am a CRNA, which is a registered nurse anesthetist. The quote that I really like to start off is, "To reach for the moon, even if you miss, you'll be amongst the stars." And I really like that quote because it encourages people to dream and reach really, really high. And the thought is that even if you don't meet that goal, you will end up somewhere really great. So I always encourage people to dream big. Like, there's no dream, there's nothing that you want that's too big that you cannot attain. So I'm going to start off by just giving random facts about myself. So about me, I am from Prince George's County, and I am Nigerian American. So my full name is Oluwatoyin Orunja, but I go by Toyin Orunja. I attended Eleanor Roosevelt High School, and I was in the Academy of Information Technology. In high school, I loved science and math, and I took several AP classes. I also did fun things. I was on the Lady Raider step team, so I loved the step, and we traveled all over the DMV. We performed at Howard's Homecoming on the step team. When I got to college, I joined a sorority, Delta Sigma Theta Sorority Incorporated. And some hobbies that I enjoy doing are working out. I mentor a lot of students and a lot of people in nursing. I actually do hair a lot. I like traveling, volunteering, and a variety of other things. So these pictures are just the picture of me running. I was running my first marathon, which is 26.2 miles. The picture of me sitting down is in Puerto Rico, and I was in Old San Juan, and it was just a beautiful scenery. And the picture of me, or the picture of the group of ladies on the bottom, is me at my university, University of Maryland, Baltimore County. And that's me and my sorority sisters, and we were at a block show. So we were stepping at a block show. Education. Tiana already said a couple of these things, but I'll just reiterate. I went to Eleanor Roosevelt High School. Then I went to the University of Maryland, Baltimore County. And that's where I attained my bachelor's degree in biological sciences. Then I attended graduate school at the University of Maryland School of Nursing. When I went there the first time, I got my master's and I became a clinical nurse leader. I also became an RN. Then I went back for my doctorate degree, and that's when I specialized in anesthesia. While I was getting my doctorate degree, I also attained a certificate in teaching in nursing and health professions because I really do like to teach. And this is just a picture of me at my graduation last year attaining my doctorate. So what is a CRNA? A CRNA is a registered nurse anesthetist, and registered nurse anesthetists are advanced practice nurses who provide anesthesia care in a variety of health settings. So this can include hospitals, surgery centers, obstetric delivery rooms, which is basically where people who are pregnant deliver. Operating rooms. We work in pain management centers to help reduce pain. And we also work in out of doctor's offices like podiatrist office, ophthalmologist office, and plastic surgeons. So we work in a variety of healthcare settings. It's not just in the hospital. And CRNAs can work in a variety of settings. So we can work independently, or we can work as a part of an anesthesia care team, where we work with a physician anesthesiologist and they direct several CRNAs. However, in 19 states in the United States, CRNAs can work completely independently. So we do not have to work underneath a medical physician anesthesiologist. However, like I said, people do both. Sometimes we work on a team with an anesthesiologist, and sometimes we work independently. So if you wanted to become a CRNA, what do you have to do? So first, you have to get your Bachelor's of Science in Nursing, and that's typically 4 years. There are some schools that have accelerated 3-year programs, but the norm is 4 years. Then after attaining your Bachelor's in Nursing and obviously sitting for your RN, your NCLEX, the board exam, you have to work in a critical care unit or the intensive care unit and gain critical care experience. So for CRNA school, you only need 1 year of critical care experience, but most people have a couple years, like 3 to 5 years. After you work as a nurse for a year on a critical care unit, then you have to go back to school for another 2 or 3 years where you attain your master's or your doctorate. Master's programs are typically like 2 to 2.5 years, and the doctorate programs are about 3 years. Some are a little bit less or more, give and take, like a couple months. However, in 2025, all nursing anesthesia schools will be switching over to doctorate programs. So my school already switched, the University of Maryland School of Nursing. We're already a DNP program, a Doctorate of Nursing Practice. So that's why I attained my doctorate when I went back to school for my to specialize in anesthesia. And then after you graduate from graduate school, then you will take the national board exam, where you sit to pass the board exam, and then you can start working as a CRNA. And this is just a picture of the University of Maryland School of Nursing, which is located in Baltimore, Maryland. So CRNA, what do we do? What is our role? So we administer anesthesia and related care to patients before, during, and after surgical procedures. So this can include diagnostic procedures, therapeutic procedures. As I mentioned before, we work in pain management clinics. In the hospital, we're often like part of like an emergency team. So if someone came into the ER and they were having difficulty like breathing, and they needed to take over, they needed to intubate the patient, which is to put a breathing tube in the patient because someone is having trouble breathing. If they're having difficulty with that, they will page anesthesia, and we will go to the ER to help assist with airway management. And the skills that you need to become a CRNA, you have to be a critical thinker because you work in a critical environment. You have to be a team player because we work as part of a team. So oftentimes at my hospital, I work with a physician anesthesiologist. So there's a lot of communication that goes back and forth with us. And also, I communicate a lot with the surgery team, so the surgeon and the surgical assistant. So you have to know how to work well in a team because they may need something that requires you to change your anesthetic. You have to be caring because a lot of people come into surgery scared, frightened. They don't know what to expect. So just being caring and talking to them and kind of letting them know what to expect and that you're going to take excellent care of them goes a long way. You have to be a great communicator. Once again, you have to be calm and act quickly in emergency situations. If someone is having difficulty breathing, I can't panic. I need to assess them quickly and figure out what I have to do to help them breathe. Whether it's just to need oxygen, I need to supplement their breathing, or if I need to fully intubate them and take over their breathing. And you have to be able to pay attention to details because subtle things can lead to big problems. Catch early, it makes a big difference. And you have to have a desire to continuously grow in knowledge. Anesthesia today is different from anesthesia 20 years ago. Technology, so many things has advanced, and we're just continuously learning. This is a picture of me on the left and my coworker Chichi on the right, and we were in the room in OB, so with on labor and delivery. I'm holding a laryngoscope, and that's what we use to put into a patient's mouth to intubate them if they're having problems breathing or if we want to take over their breathing. So demographics. Unfortunately, this field is not very diverse. There's only 1.3% are African Americans, 2.5 Hispanics, 2.7% are Asian or specific islanders, less than 1% are Native American, and 3.8% identify as other or non-Caucasian. So that leaves us with 89% of the profession being white Caucasian. So it's not very, very diverse. There's about 54,000 CRNAs and SRNAs throughout the country. So SRNA is a student registered nurse anesthetist. So basically someone in school for anesthesia. And the profession is almost 50-50. So 53% female, about 46% male. The average age is 45.2. I am not 45. I'm a little bit younger than that. And the average salary is actually $166,000. And actually in the DMV, the average salary is higher than that. And depending on what type of work you do, or if you go into independent contracting, you can make well over $300,000 a year being a nurse anesthetist. So we are well compensated for what we do. So what to expect when you, as a CRNA and even as a patient. So as a CRNA, there's something called the preoperative period. So this is the period before the patient actually gets to the operating room. So my job as a CRNA, when I come in the morning, I change into my scrubs and I go to my operating room. I check my anesthesia machine, making sure it's working. I check to make sure I have all the appropriate monitors. I also check to make sure I have my airway equipment, everything that I need during the case. Definitely have to make sure I have my medications, which is going to help, put the patient to sleep, maintain them asleep, and treat any pain and other things that may need to be addressed during the procedure. Then after I make sure the operating room is set and ready to go for the patient to arrive, I go to the preoperative suite where the patient is staying, and I meet them. I introduce myself to them. Then I start to ask them a lot of questions about their health, any surgeries that they may have, any medications that they're on. And then I also review any documentation from their doctor. And this is very, I need to know if my patient is hypertensive, if they're diabetic, because all of that can change my anesthetic plan of care. So it's important to really, really do a good interview on your patients to know, how their disease process will affect, the anesthesia. So these pictures, this is a quick video of me setting up I think this is a video of me drawing up medications in the morning. So you can see I'm dressed up in my full OR gear, drawing up my medication, putting on labels because every medication needs to be labeled to prevent errors. And yeah, it's nothing more than that. The top picture with the tubes, the top right picture, that's an example of an airway setup. So the tubes are the tubes that we use to actually put into the patient's throat once they're completely asleep. They can't feel it. We put that into their throat, and that's how we access their airway. So the tube will come into their mouth and kind of stop around right there, and then that's how we breathe for them. We'll start to our machine will start to breathe for them, and then this is the laryngoscope that we actually use to put the tube in their mouth. And these are like airway, additional airway devices that we could use if we were having trouble or if we needed additional help. And these medications are the typical medications that we use to put someone to sleep. So I'm sure people have heard of the medication Propofol. Unfortunately, that's the medication that was partly attributed to Michael Jackson's passing, but that's because he was taking Propofol at home without being monitored. So Propofol will make you go to sleep and it'll make you stop breathing. That's why it's very important for us to have our monitors on our patient. We can check their oxygenation, we can check their saturation. So that's Propofol. This blue one is fentanyl, and that's just a pain medication or narcotic. And this is a muscle relaxant to relax all your muscles in your body before we intubate you. And these are just additional medications. I can't actually read them, but things that we use. So after the preoperative period, then comes the intraoperative period. So that's the period when the patient actually goes into the operating room. So during that period, we transport the patient to the operating room. Then we put them onto the table. We start to connect our monitors. And when I say monitors, I'm talking about blood pressure. We monitor their heart rhythm and beat. We monitor their heart, their oxygenation. And then this picture is showing a CRNA pre-oxygenating the patient. So before we even give you any medications, we'll ask you to take nice deep breaths to fill up your lungs with oxygen and just breathe in. And that kind of allows you to kind of fill your lungs up with fresh oxygen. That way, once we do give you the medications that will stop your breathing, because you've breathed in so much oxygen, you can go 5 or 7 minutes without taking a breath. Of course, when you're you can go 5 to 7 minutes without taking a breath because you've we have pre-oxygenated our patients. So that's what this patient is doing. Patient's taking nice deep breaths. The CRNA is watching them. And then after that, once that 3 to 5 minute period of pre-oxygenation starts, that's when we start to give our medications. And like I said before, these medications like Propofol, it will stop your breathing. So that's why the pre-oxygenation period is very important. After that, we gave our medications. Now our patient isn't breathing anymore. We've given muscle relaxants if it's appropriate. Now they're not moving. Now we can intubate our patient. So we take the breathing tube and we actually insert that breathing tube into their mouth, down their trachea, and it stops somewhere around there before the lungs deviate. And then we connect them to the anesthesia machine. And the anesthesia machine is actually what's going to take over their because the patients are right now, they can't breathe and they're relaxed. So if I give you a relaxant, you won't be able to move any muscle in your body, including your lungs. So the anesthesia machine is great because that does our breathing for us. And then during the case, as the machine is breathing for us, we're monitoring the patient's vital signs. We're looking at how they're breathing and just monitoring them while doing the case. Afterwards, at the end of the procedure, if it's appropriate, we will take the breathing tube out, which is called extubating the patient, and then we will transport them to the post-anesthesia care unit. So post-operative period, that's the last period. So this is when we transport the patient to the PACU, the post-anesthesia recovery unit, and we give a report to the nurse. After giving a report to the nurse, and when I say give a report to the nurse, this is when we let the nurse know about the patient's medical history, i.e. this patient is 67 years old, they're diabetic, they're hypertensive, and then we'll tell them what medications we use during the procedure, what antibiotics we use during the procedure. And then once the nurse feels comfortable with the information that I've given him or her, then I will make sure the patient is stable. So I'll look at how they're breathing, look at them to see if they still need oxygen. I'll look at their vital signs. Are their vital signs appropriate? Do the numbers look good? And if everything is good, then I'll make sure all of my post-operative orders are in. And these orders are in case the patient wakes up and they have a little bit of pain. I order pain medication. Anesthesia itself, the gases and narcotics or pain medications that causes people to be very nauseous. So during the case, we give patients medications to reduce the nausea, but sometimes they still wake up nauseous. So in my post-op orders, I will give medications to help with nausea and vomiting. My patient is okay, the nurse is satisfied, my orders are in, I close the case. So the impact that CRNAs have on society. So CRNAs increase the access to healthcare, especially in rural areas. Right now in the DMV, this place is a metropolitan area. So there's a lot of hospitals around in DC and even in Baltimore. So this area is well populated and so usually does not struggle, but CRNAs are still used a lot in this area. But when you go to rural areas, like more areas that are a little bit more remote and country, when you go to those areas, CRNAs are the primary providers of anesthesia because it's difficult to get healthcare workers out there because a lot of people don't want to go there. And sometimes it's just sometimes like there's just not enough anesthesiologists to kind of spread all around the country. So in areas that are more rural, CRNAs are the primary anesthesia providers. And like I said, also in the DMV area, we're in almost every hospital. In the U.S. military, we're actually the primary provider of anesthesia. So if someone's in the military, in the Army, in the Navy, and they're like at Walter Reed or Fort Belvoir, CRNAs are the primary providers of anesthesia, especially when people are overseas too. When people are overseas, like doing a mission, CRNAs are the ones who are providing anesthesia. Our impact on society, we also provide access to high quality anesthesia, and because we're more cost effective, because to pay a CRNA is less than what you would pay a medical a medical anesthesiologist. So when you use more CRNAs, it makes healthcare more affordable because the cost is not as high. The cost of 4 CRNAs is way cheaper than the cost of 4 anesthesiologists. Hence why many hospitals in the area, they're now doing most of the hospitals use an anesthesia care team model where you have one anesthesiologist covering 3 to 4 CRNAs. And that way, the bill is not as high, the medical cost is not as high, and it's tolerable. And then, like I mentioned before, we practice with a high degree of autonomy and independence. So we can work with the anesthesiologist, a medical MD anesthesiologist, or we can work independently. So these are some pictures of me at my hospital and different providers. So this picture here is, I was doing a dental procedure, a pediatric dental procedure, and this is the surgeon, the dental surgeon, and this is her assistant. This is me with my coworker, Chi-Chi, and OB. This is me again in the operating room, just making sure I bring my patient in. And this is one of the students, John Hunt. He was doing a pediatric case. As you can see, he kind of decorated the breathing bag for the kids just to make them smile once they get in the room. And the video in the middle, this is just my coworker Chi-Chi setting up an epidural. So it's one of those fast videos. So it's going to play really fast, but it shows you. And she put on her gloves before she opened the kit. It's a little backwards, but it's okay. You get the point. So she's drawn up all her medications and getting everything set before she even touches the patient to do the epidural. And I know that was kind of fast, so I'll play it one more time. But when we're doing epidurals, we have to use sterile gloves because it's a sterile procedure, and we're getting access to the spinal column, spinal cord. And I love to put in epidurals. Epidurals are fun to me. But yeah, this is us in the OR. Pretty, and this area, thankfully, so this area is pretty diverse. So at my hospital, you'll see a lot of African Americans. You'll see people, Filipino. You see Hispanics. There's a lot of different cultures around this area. But as we know, the United States is not as diverse as the DMV. So how is anesthesia connected to biotechnology? So when answering this question, I first had to research what is biotechnology. So biotechnology is technology that utilizes biological systems, living organisms, or parts of this to develop and create different products. What is anesthesia? Anesthesia is a state of controlled temporary loss of sensation or awareness induced for medical reasons. So how I connected that to biotechnology is biotechnology allows us to use various equipment and machines to monitor the patient's depth of anesthesia. So with my monitors, by looking at my monitors, I can know exactly how much anesthesia is on board and how deep the patient is in anesthesia. Biotechnology also allows me to administer anesthesia safely by monitoring the patient's physiology, i.e. their heart rate, their heart rhythm, their oxygenation, their blood pressure, and more. So I have another video here, and before I play the video, this is me in the operating room taking a video of my patient's vital signs. So this number here is the heart rate. So the patient's heart rate is 119. This is a pediatric patient, and this is actually the heart rhythm. So this heart rhythm is important to me too. Then this number here is the oxygenation. So they're at 100%. So you don't get any better than 100%. So I'm monitoring that, and this is their blood pressure, 90/44. So these are the things that I watch continuously as I'm providing anesthesia during a case. This is the anesthesia machine. And this part right here is giving the patient breath. This is like acting as their lungs. And when I play the video, you kind of heard a beat. Dun, 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 dun. So that beat is that noise is important for two reasons. The first reason is just by the tempo of the beat, I can close my eyes and I can know what my patient's heart rate is. So that tempo, how fast it's going, it corresponds to how fast the patient's heart rate is. So that 119, that beat is beating 119 times every minute. And then the pitch of that beat, beep, 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 versus beep, 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 those two pitches would tell me how oxygenated my patient is. So when they're at 100%, it's high, beep, beep, beep. But when they start to drop to 95, 93, 82, it'll go beep, 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 beep. It's a very scary sound for an anesthesia professional. But I'm gonna show you the video again, and I want you to pay attention to we call them bellows, and they're kind of rising and falling. And that's actually the machine pushing a breath into the patient's lung, because I told you we take over their breathing when they're sleeping. This is it. You see it going up and down? All right. So to continue the connection of anesthesia to biotechnology. At least for anesthesia, it's important to have a great foundation in sciences, including biology, chemistry, physics, anatomy, physiology, and microbiology. We have to know and understand the body's normal physiology and baseline across age groups. I just told you that I was doing that case that I was doing was a pediatric patient. Those vital signs, some of those vital signs may not be appropriate for a person that's 50 years old. You know, that heart rate is too high for somebody who's 50 years old. But because I know I'm working with a pediatric patient, I know that a heart rate of 114 is appropriate. We also have to understand how diseases change the body's physiology. So I have to understand if my patient is a diabetic, or if they're hypertensive, if they have hypertension, how are my medications going to affect that? You know, are they going to be hypertensive during the case? Are they going to, you know, drop? Is their blood pressure going to drop really low? So it's important for me to know how my anesthesia will affect that, because it does affect different things. And patients who have certain conditions respond differently. And then, so not only does their disease affects the anesthesia, my anesthesia affects their body. So just putting all of that together. And then tying this into technology. Technology is how we are able to administer anesthesia and monitor the patient safely. So as you saw those monitors, that's all technology. With anesthesia, we have a whole, like, I think we call them biomed or biotech or something like that. And that's a whole office that's dedicated to just helping us manage our machines, making sure they're working right. If something is not matching up, if those bellows aren't moving up and down, or if a monitor is off, we call biotech, and they come immediately, and I wish I knew what they did, but they do what they do to fix the machines. But as CRNAs, we have to be comfortable with various types of biotechnology, because there's new products that come out all the time. So today I may be using one anesthesia machine, but when I go to my other job, my part-time job, their anesthesia machine is completely different. So I have to be comfortable with different types of biotechnology, because different places use different things. And what we're using today, I'm sure will be different from what we're using in 10 years. We also have to stay up to date with new advances in biotechnology, which kind of goes along with what I was saying. And then when I even became a nurse in 2012, all of the patient's medical records were electronic. And before they used to be paper, but now everything's moving to electronic. So just technology is very, very important when it comes to science, when it comes to healthcare, because you see it in everywhere. You can't enter a hospital without seeing a computer. Everything is computerized. And now, because of COVID, you even see people doing electronic health visits. So sometimes now people are doing their visits with their doctors like over the computer, because they don't want to go into the office to increase their risk of, you know, catching COVID, or just to be extra safe. So technology is very, very important. It's super important in anesthesia and healthcare and to science. So I want to show a brief video from the American Association of Nurse Anesthetists, and that's our national organization. And it just talks about CRNAs. I'm not going to play the whole video. I'm going to play the video for about a minute, 20 seconds. Let's take a little bit.
I think in life, you have to nail down something that you ultimately need to do while you're here.
So I always excelled in science in high school and when I started college, but I also had the desire to help others.
I was an EMT in high school. I knew I wanted to go into the healthcare field.
I saw all these nurses taking care of my. I said, I want to be that.
I wanted to make a difference. I received report from anesthesia people. I thought they were doctors. Once I found out they were nurse anesthetists, I was hooked.
They were very caring. They were very engaged and involved.
The amount of responsibility a nurse anesthetist has is profound.
One of my colleagues told me that I have the characteristics of a nurse anesthetist, being a leader, being independent, always looking for knowledge.
Those qualities are absolutely something to look up to. It's very empowering.
Being a nurse anesthetist, there are myriads of opportunities. You can work for the military. You can work for the government like the VA.
You can take on students.
You can work as a faculty, as a nurse anesthetist professor.
You can also participate by being active in your state organization when you become.
All right, so that was just a little video from the American Association of Nurse Anesthetists. And I don't know if you remember the demographic slides. There's only 1.3% of nurse anesthetists who are African American. So in my journey to becoming a nurse anesthetist, I didn't know anyone who was a nurse anesthetist. I actually knew more anesthesiologists, but I didn't have any mentor when I first started because I didn't know anyone who had done it. So this diversity CRNA was instrumental in me becoming a CRNA. I met so many nurses of color. I met so many people who were already in the profession who were willing to teach me and mentor me and tell me what steps I need to do in order to get into anesthesia school. So that I always attribute my success or my getting into school had a large part to do with diversity CRNA. So I'm just going to kind of take you to their website just so you can kind of get a little idea of what the website is about. Sorry. All right. So it's Diversity in Nurse Anesthesia Mentorship Program. And as you can see, they have workshops. So this is them like teaching students, somebody's intubating right now, putting the tube down somebody's airway. That's what we call intubation, if they're not breathing or if we're doing it for surgery. And that's the laryngoscope blade that she's using. And now she's making sure that she's in the lungs. So she's going to give the patient a breath. And as she gives the patient a breath, she watches the chest rise. And this is, if somebody has a difficult airway, you can actually put a camera, this thing is a camera, has a camera on the end, and we put that down the patient's throat and we actually it goes through their trachea. And this is somebody doing an epidural or a spinal. Their mission is to inform, empower, and mentor. So this is one of their many conferences that they do. And you see they bring out so many minorities to help them get into anesthesia school and be successful once they become a nurse anesthetist. And some of the facts, this is where I got my facts from, the 1.3%. So like I said, it's not a very diverse field, but we are increasing. Only 11% of CRNAs are of color. And yeah, this is their website. This is success stories about people who became, CRNAs and their stories. So diversity, if you're ever interested in anesthesia, definitely visit this, or nurse anesthesia, definitely visit this page because it really helps you and it shows you some of the things that go on. This is peripheral nerve blocks, which is where we use, we kind of use ultrasound to visualize nerves. And then we will insert numbing medications around the nerves. And this is an epidural. And back to the beginning. So my advice to you, well, first, this is a picture of me in high school. This has to be in 2004, maybe. Let's say 2003, 2004. And like I told you, I was a lady writer, so I was on Lady Writer Step Team. This is me. And these are the people that I was on Step Team with. And this was us at Howard's Homecoming. So my advice to you is to stay focused in school. Every subject matters. Definitely, like, every subject matters, even history. There's things that I'm in casual conversations, there's things that come up about history, like with the whole debate. I apologize, with the whole debate and everything that's going on, with the elections going on, like, it makes me it makes me go back to my history and just, see what things are repeating itself. I actually recently watched the play Hamilton, and I loved the play so much that I went back and I just started researching Hamilton the founding fathers. And I'm like, oh my gosh, I learned all of this in high school. But I say that to say, don't ever think no knowledge is ever wasted. That's what my dad used to tell me. No knowledge is ever wasted. So science, history, math, it all comes up in some way. Getting involved in extracurricular activities and have fun. The Lady Raider Step Team was one of my best experiences in high school. I performed so much. It was fun. It was exhilarating. I met new people. It was amazing. And I stayed active in college and in graduate school. And I want to tell you guys, it's okay to make mistakes. It's okay to, it's okay to make mistakes. If you didn't do well one semester, don't be defeated or discouraged. Just come back the next semester and go harder and learn from your mistakes. I think that's mistakes build character. And once you learn from them, like, you're so much better. So don't feel bad if you didn't start off right, or even if you started off right, but then you kind of went backwards. Stay encouraged. This is a long-term race. It's not a sprint. It's a long-term journey. And you don't have to know what you want to be today. It's okay. I don't know if I want to be a doctor. I don't know if I want to be an engineer or whatever, like a soccer player. It's okay if you don't know what you want to do today, but you have to be open to learn about different careers and different professions. And I think that's how you'll be exposed to more and you'll learn more. And then I encourage you to build connections with people. There's so many, like, doing this, and I'm being a member of the STEP team. There's so many of these people that I know today who are actually really big people. Like, they have a good job, so they've helped me here or there. When I went to college and even graduate schools, I stayed involved on different committees, and my network just expands. And I got new opportunities from just being involved and staying involved with different people and friends. So I encourage you to expand your network and to build connections with people. Sometimes have you ever heard it's not what you know, but it's who you know? That's very, very true sometimes. And once again, seek mentorships, seek out a mentor for guidance as you advance academically and professionally. I wouldn't be where I am today if I didn't have somebody. Like, I met so many people from Diversity CRNA that really helped me. And I'm still very close to many of them today. And I attribute my success to a lot of other people who guided me along the way. And that's why I always mentor people. There's so many people that call me because they have questions about nursing, or they want me to read their personal statement, or they want to do a mock interview. And I do all of that with them because I believe in paying it forward. Somebody helped me, so I'm going to help somebody else advance. I want to thank you guys for letting me share my career with you guys. I hope I was not too boring. I know I talk fast. I really tried to talk slow. You guys are on the path to greatness, so just keep it up. Feel free to email me at torunja@gmail.com if you have any questions about what I talked about today, or if you're seeking mentorship or anything, just call me. Just email me. And then I recently started an anesthesia page called Anesthesia_melanated. I only have 2 posts on it, but we plan to post more material. So it's me, my coworker Chi Chi, that was in some of the pictures. So definitely follow us on Instagram, and we'll be posting things that are related to anesthesia and fun facts about science and anesthesia. But that's it.
Okay, thank you so much for that really great presentation. And you definitely spoke at a good pace for everyone to keep up.
I got a question. What hospital you work at?
I work at Southern Maryland Hospital, but I also do part-time work at Doctors Community Hospital in Greenbelt and at Sinai Hospital in Baltimore.
Thank you.
You're welcome.
Okay, and we have some questions in the chat. This is kind of a 2-part question. Okay. It is, when did you know you wanted to become a CRNA? And was it something that you always wanted to be, or did you have other things that you were looking forward to?
So that was a great question. I did not always know I wanted to become a CRNA. Like the lady in the video said, I was always interested in science and math. So when I went to college, I was like, let me major in biology. And, at first I was like, oh, I'm going to be a doctor. I'm going to be a pediatrician. But then in college, I was like, I'm not sure if I wanted to do that anymore. So around my senior year of college, I decided to not pursue medicine, but to do a master's in nursing. And that was like 1.5 years. And my thinking was like, it's only 1.5 years. So let me do this program. And if I like it, I'll stay in nursing. And if I don't, I'll do something else. So when I got to nursing school, that's when I fell in love with nursing. And I knew that I was going to stay in nursing, and I was just going to pick I would get another degree, an advanced practice degree, but I wasn't sure if it was going to be like a nurse practitioner, a pediatric nurse practitioner, or a nurse anesthetist. So when I became a nurse, I worked at Holy Cross Hospital in Silver Spring, Maryland. I started off on the med-surg unit, but when I went to the ICU, the intensive care unit, that's when I was like, I like this. There's a lot of monitors, a lot of like sick people, and there's just I felt like it was using a lot of sciences. Like they were on so many drugs, and I had to learn the drugs mechanism of action. And I was like, okay, I do like this critical care environment. I like what I'm seeing. I like what I'm doing. And then I also wanted a little bit more independence. So I would say it was when I got to the ICU that it confirmed that I wanted to do nurse anesthesia. So I actually ended up shadowing a couple nurse anesthetists. So I shadowed about 5 different people. And everyone I met said that this is the best thing I've ever done. I love my job. I love, a lot of people usually talked about the income because they get paid so much. But I was like, I don't want to work somewhere, get paid a lot and hate my job. So I wanted to see if people really liked it, and people did. And I love my job. I love it. I could do pediatrics. I could do epidurals. I could do babies. I did a 2-year-old the other day. Then I did a 60-something-year-old. Like, it's so diverse. I'm about to start working in a plastic surgery office where people are getting like different types of surgeries, tummy tucks, breast lifts. And there's just so many places that I can work. And I love the versatility of it. And I like the independence. So I did not always know what I wanted to do. I probably figured that out I figured out I wanted to be a nurse at 21, and maybe I wanted to do anesthesia around 25.
Okay, so another question that we have is, as a CRNA, you said you have to remain calm in situations that cause most people to like freak out or lose control. So have you ever made any mistakes on the job, and what lessons did you learn from those mistakes?
Have I made mistakes in the job? Mistake is kind of such a harsh word. There's some things that I could have done better. And when I say you have to stay calm, in my mind, sometimes I could be freaking out, but I'm anesthesia. I have to be calm and control. So like when stuff starts to go left or go, down the road I don't want to, like in my mind, I'm like thinking real fast, but I'm not like, I'm not running all over the place. I'm, okay, so get me this, get me that. And I would say like, I haven't made a mistake. Well, there's things that I could have done better, and like maybe given too much of a medication, and now my patient takes a long time to wake up. But they still wake up, but you just have to, people like to kind of hurry up and go. They don't want to sit down for 15 minutes waiting for a patient to wake up. So certain things like that, I was like, oh, maybe I shouldn't have given this much, but I should have given that much. So now it just takes my patient a long time to wake up. But when they wake up, they're they're healthy, they're okay. So I would say certain things like that, just learning kind of how much to give, and it's always better to start small because you can always give more. That's what we say in anesthesia. Give a little bit, and if they need more, you can always give more. But when you give a lot, you have to wait for that drug to wear off. So, but everything I've done has always been in a safe environment. So if my patient's taking a long time to wake up, that just means I have to keep them on the machine, have the machine breathe for them for maybe an extra 10 or 15 minutes, and then they come back breathing on their own. And just I guess managing people's airways, because certain people, like when the bigger you are, or like the bigger your neck is, the harder it is to manage your airway. So just learning what equipment I want around me when I'm doing anesthesia, what makes me feel comfortable. So there's certain things that I always want around me, because I know if I have X, Y, and Z, whatever happens, I'm good. I'll be able to ventilate that patient. I'll be comfortable in almost any situation. So that's what I would say. It's just learning, but still always in a safe environment.
Okay, another question. I think you already touched on this a little bit, but how stressful is it being a CRNA during COVID time?
Oh, that was stressful. It wasn't stressful, but what is COVID, right? Nobody really knows. Every day they're saying something else, and is it airborne, is it droplet? So just not knowing what type of disease we were tackling, that was a little bit nerve-wracking. People were dying a lot in the beginning, not just older people, but even some younger people. So I think it was emotionally draining. I saw a lot of people die. I saw people in their 30s and their 40s die. So that was hard. At my hospital, we had to intubate and put additional lines, like a central line, which is basically a big IV that goes into your heart. And we had to do that for all the COVID patients. So if somebody was diagnosed as COVID, they kind of like handed them over to anesthesia. So we were constantly working with COVID patients and putting on all of the safety, the protective equipment. You could be in a room for 2 or 3 hours with a COVID patient, and like you have your N95 mask on, you have another shield on. It was physically exhausting sometimes. I still felt safe because we had our PPE, we had our personal protective equipment. So I always felt safe, but it was more so hard on the heart because then these people had COVID, but they couldn't have anybody in a hospital with them. So you're seeing people die by themselves. You're seeing people who's 39 who don't get to say bye to their children. So for me, it was more heavy on the heart than it was like, oh, I don't know what to do. Because, we still intubating. I do that every day. Putting in lines and people, we do that. So it was still the same skill set, but just doing it in that stressful environment and working with a disease that you don't know that's.
Okay.
My question is, so I remember you saying something about an older person having a slower heart rate. So I wanted to ask if, as you get older, does your heart rate slow down, and does that affect the amounts of anesthesia you can give someone?
Okay, so it's not necessarily the normal heart rate is like 60 to 100. 100 is a little bit on the higher side. So that heart rate was 119. But kids it's not that your heart rate gets slower when you get older. It's just when you're a child, your heart rate is higher. So like kids, 2-year-olds, 1-year-olds, 3-year-olds, their heart rate is just higher. When you become 60 or 70, your heart rate doesn't necessarily, I guess it doesn't necessarily slow down. And if it's slowing down, it's because something abnormal is happening. The thing about older people is that their circulation time is longer. So the amount of time it takes my blood to circulate from my heart all the way to my feet back to my heart it slows down as you get older. So with elderly people, we just have to give less medication, and we have to give it slower, because if I give medication now and I expect it to work in like 30 seconds, well, their circulation time is a long time. So maybe in me, it'll take 15 seconds, 30 seconds for that drug to start working because my circulation time is like this. But an older person, it's like, do, 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 do. So you think that a medication is not working, but it is working. You just need to give it time. And they do actually require less medication, but that's not because their heart rate is slower. That's just because as you get older, you require less. Please excuse the text messages that are coming in.
We have a question. Are there any misconceptions that people have about your line of work? And how do you go about falsifying or dealing with those misconceptions?
I think that because people think that we're not medical doctors, that, we can't do as much or we don't know as much, And medical doctors do go through extensive training, but we are trained to be independent providers. So a doctor or not, a medical anesthesiologist or not, I can do anesthesia. I know how to do anesthesia from beginning to end by myself. So I think that people think that CRNAs are heavily dependent on doctors and we can't work without a medical doctor, but we can. We definitely can. However, most states we still practice within the care team model, i.e. like we work with one doctor and a doctor is covering 4 rooms. So what typically happens is like I run my own room. Let's say there's OR 1, 2, 3, 4. There'll be a CRNA in OR 1, 2, 3, and 4, 4 different CRNAs in that room, but then there'll be a medical doctor covering that CRNA. So let's say, oh, I need help with something, or for whatever reason, there's a physician covering me or like a backup. So I actually don't mind working with medical doctors. I like working on a team because if I ever have a question or if I need an extra pair of hands, I can call my backup, which is my MD. But like I said, if I was in, I don't know, in a rural area in Kentucky, there may not be a medical doctor there. So I would have to work independently. But I just go by educating people. I don't get offended because I wouldn't know what a nurse anesthetist was if I wasn't a nurse. So I'm not offended at all. I just educate people about their misconceptions and kind of take it like that.
How old do you have to be for that little nursing program?
You don't, there's no age minimum. As long as if you have a high school degree / diploma, you can apply for nursing school, period. And after nursing school, if you get your 1 year of critical care experience, you can apply to anesthesia school, nurse anesthesia school. So there's no age minimum. I think I've seen somebody 23 years old in anesthesia school. That's young, but there's no age minimum.
How many years do you have to stay in school for a doctor?
For
a surgeon.
For like a surgeon or you said for a surgeon?
Yeah.
So medical doctors, give or take. So they go through, so you graduate college, you go through 4 years of undergraduate. So that's 4 years. Then you go through 4 years of medical school. That's 8 years. And then you go, I believe for general surgery, that's another 5 years of residency, which is not school. It's like kind of like you're practicing, you're learning about, but you're practicing. So that's another 5 years. So that's 8 plus 5, which is 13, before you can practice on your own and start making real money. And if you want to be an anesthesiologist, it'll be 12 years, because anesthesia is 4 year residency. So four years undergrad, 4 years medical school, 4 to 5 years of training.
Okay, I want to go back to reading some questions from the chat. What was your biggest obstacle when deciding how to further your career in the medical field?
Not believing in myself, thinking like, I cannot do, because I started off on as a medical surgeon on a med surg unit. So that's, patients don't have that many monitors. Actually, they're not on monitors. Like, it's a low, it's people are still sick, but they're not like critically sick. So when I would go to the ICU and I would see people intubated and on all these monitors, and I'm like, or using all these drugs, I'm like, this is crazy. Like, I don't know if I could do that. So kind of like doubting myself, or thinking like, or like seeing the statistics, there's only 1.3% of CRNAs that are African American, and I'm saying like, can I really be a part of that 1%? Or like, my school is the only school in Maryland that is the only nursing anesthesia school in Maryland. So they only accept 25 people, and they have over 300 people that apply. So self-doubt, thinking like, oh my gosh, I only work at Holy Cross Hospital. I've only been a nurse for a year. Are they really going to take me? Because this nurses has been nurses for 10 years, and they work at like shock trauma or like, Washington Hospital Center, which is huge. So I would say self-doubt was trying to kill the self-doubt that I had was probably my biggest obstacle. But once I got over that fear, I killed it.
Oh, wow. Okay. How do you maintain your personal and work life? And do you have time to like take off or travel or things like that?
Oh yeah, I still like traveling. Life now is great. I get 6 weeks of vacation every year, so you can think of like a week every other month. I like, one of the reasons I did choose anesthesia is because I do a combination of 8 and 12 hour shifts, and they can work me like a dog for 8 hours or 12 hours, but once I get home, I don't bring my work home with me, and I think that allows me to have a lot of work-life balance, because I work 3 to 4 days a week at Southern Maryland Hospital. So that means every week I have at least 3 days off from there, 3 to 4 days off. So that gives me time to de-stress and to do things that I want to do. And now I have the money to do so because I'm actually getting paid. I'm not in school. So I think that it's a great balance. I think it's a great balance. And key for me is like not bringing my work home. Where I always say, work me like a dog while I'm here. But when I go, and my time is mine. And that's one thing I appreciate about my job. And my job is close to my house, so I don't have to travel so far.
Okay, and this might be our last question. What was your biggest achievement during your career so far?
My biggest achievement in my career. So I'm like a year and a half in. And the things that I'm most proud about, honestly, are like when I was in school, I was a member of the American Association of Nurse Anesthetists is our parent organization, and I applied for a position to be the student representative on the foundation, and there's only one student in the country that could do it, and I got it. And that was one of my proudest moments as a student, because I got to travel all around the country to conferences for free, meet people. I met the president of the association. I met so many people. Even just this morning, one of the board members contacted me and just said, "Hey girl, just checking up on you. I'm so proud of you." And I got to learn so much. And I remember saying, should I even apply for this position? Once again, like that self-doubt, it always kind of lingers, but you have to learn how to kill it. I'm like, this is a national position. It's a lot of students in the country, but I applied for it, and that was my best experience as a student. And I would say as a CRNA, my best experience is honestly mentorship. Like, I get to mentor so many people, and then I get to see them come back full circle and become CRNAs, pass the board exam. Every day, like, my biggest accomplishment is just like making my patients happy. Like, they come in scared, they come in nervous, some of them are crying, or even with helping a laboring mother, giving her an epidural and seeing her go from like tense to just sleeping. Like, there's no greater satisfaction than like putting an epidural in somebody who is who has crucial labor pains, and before you walk out the room, they're sleeping. I love that feeling.
Ooh. Okay, so it is rolling into 12:44. So I want to go ahead and thank you for talking to us and for your presentation. And I want to thank Director Richardson, Dr. Schuster, Ms. Barker, McKinley Administration, as well as the Distinguished Academy of Biotechnology Scholars. And I want to ask if there's anything else anyone wants to add, or, well, yeah, teachers, if there's anything else you want to add. And also to remind everyone that there's a evaluation form for this meeting, and your teacher should give it to you. So yeah, if there's anything else, Director Richardson or Dr. Schuster, anyone wants to add?
I'd just like to say thank you, Tiana. You did a fantastic job. Thank you, Dr. Orunja. This was truly remarkable. Our students are definitely engaged, and we learned so much. So thank you deeply for your time and your commitment to student achievement.
Thank you for having me.
Dr. Orunja, that was great. That was great.
Was it good? I don't know.
No, it was better than good. It was.
Yeah, that was really good.
You did a great
really?
job.
It was
Yeah, and I followed your Instagram already.
Oh God! I was like, there's only 2 pictures on it. This is gonna motivate me to put more content on.
I really like the sped up videos too. That was a really nice touch.
Thank you.
Yeah, that was great. For kids who love the idea of being in this kind of really important industry, and that was such a great hook for them to be able to physically see that, because if they don't have that knowledge, they may not be able to visualize what you're talking about, but that just made it so much more accessible for them. Thank you.
Oh, no problem. I'm happy you liked it.
And Dr. Orunja, our assistant principal, is actually on the call. She joined us today. Dr. Jackson.
Hi.
Hello.
Nice to meet you. I see you out there doing your thing, Miss Delta Sigma Theta, Alpha Kappa Alpha. Hey. I am thoroughly impressed. I'm impressed with your work. Especially for someone who's just now about to have surgery in a few days. And so when I was listening to everything that you were saying, and I was like, oh boy, it was an opportunity for me to really see what happens. All I know is like I'm oftentimes rolled into the room and it's like, oh, here's your team and da 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 da. We're just gonna give you a little something to just kind of relax you a little bit. And next thing you know, you're waking up from surgery. And so just to see a Black woman doing what you're doing is amazing. And I think our students need to see more of that. So I commend you for your practice. I commend you for your hard work and dedication to get where you are. It certainly is not something that's easy. If it were, everyone would have it. Everyone would be doing it. And so I am elated at this particular one. I feel like this has been the best one yet for us. I've sat through several of them, And I am like completely impressed. I think you really drove home the entire presentation with your visuals. It allowed our students.
She pushed me to get pictures and videos.
Great, Director Richardson. She's doing a phenomenal job with the academy, and I'm proud of her. She knows that too. And I would say, like, I feel like even though we weren't able to be in person and experience this in person, I feel like we experienced it in person. I felt like I was there. Like I felt like I was totally all into the area and everything. And I can only imagine the feedback from our students. I am proud of them as well. They have very important questions that they asked, even in the chat, just their level of engagement. I'm curious to see their feedback and hear more from them. And I just look forward to having you come back and speak to our students in the future. Yeah.
You guys make me so happy. Thank you so much. I said this presentation low-key stressed me out because I just wasn't sure what to do. And I wanted it to be good, but I didn't know how people were going to receive it. So it's a little scary to present, and they're just high schoolers, but I was still like a little nervous of how I know what I do, but to try to communicate that to someone else effectively and in layman's terms, you know, and for them to get it. So it's a little nerve-wracking, but I will present anytime for you guys. I just love to share what I do and to encourage people because, like I said, mentorship is key. I wouldn't be where I was if I didn't have people holding their hand back out and helping me climb up to the next level. So I'm happy that you guys enjoyed it, and thank you for your feedback.
Awesome. Thank you. Director Richardson, we'll catch up.
Absolutely, Doc. Thank you. Thank you for stopping by. I appreciate it.
All right. Bye-bye.
Bye-bye. Yeah. All right, Dr. Orunja, it's like, I don't know. I can't, I don't know. Everybody's saying it best. Like, it was just phenomenal. Like, it was really, really great. I can't, like, say it enough times. And our kids are definitely going to fill out a survey for you. So I'll make sure that you get all the results and you can see what they thought, you know, if you're open to that. Like, their feedback is important.
Sure. And I'm sorry, I've been so last minute, girl. I'm closing on the house. So I've been stressed out with that, you know? So it's like, I'm trying to close on a house, and some days they're asking me for this. I think I worked both for these last weekends, so it's just like it's been a lot. So I was like, and I was like, Ashley, this presentation. I was like, I gotta do it. And she's like, you're good. You're gonna be good. Ashley read it for me this morning. She was giving me feedback.
All right.
I was like, girl, I finally got a little bit more calm, but it wasn't the presentation. Honestly, is not stressful. It's making it. Right. It's making it relatable, making it pretty, you know, because the content, I could write that. That's not hard. I do that every day. Like, I know what I do, but making it visually aesthetic and trying not to talk too fast. Did I talk fast?
No, you were great. Like, I swear to God, it was just perfect. You know, you weren't talking so slowly that you would lose anybody's attention. It was just actually a perfect pace, like to keep everyone engaged. Everything that you said was relevant, you know, necessary. It connected to the visuals you provided. Like, it was phenomenal. So. Like, there's no way around it. I swear. I think that, I don't know, it looked like you put a lot of time into it and you just really thought about the process. And I'm glad Ashley looked over it for you. That's great. It's always awesome to get feedback and everything. But no, you guys are great. You guys are great.
Thank you. And you honestly provided good feedback. Because when you were saying, tell us what you do, tell us and I was like, I literally was just taking notes of what you were saying, and I like just checked off each box. You was like, have a picture of you on the step team. I was like, Lord, do I have that? I was literally like, all your feedback, whatever you do to presenters, keep doing it. You know, give them feedback because it seems simple, but it's not that obvious to us, you know? And I'm like, you want pictures of me in there? Me?
Absolutely. Yes. Yeah. No, that's why it's important for us to, like, I want to meet you guys and, like, talk to you beforehand and then, you know, have you speak with our scholars if we, you know, identify a student moderator, which I want to continue to do. Like, this was our first time having a student moderator, but I think it's important for us to have those conversations and for you to say, yeah, like, I'm not thinking about this part or what should I include, what should I add? And I'll absolutely give you that feedback, you know, because in a way we're all educators. I've been a teacher longer than I've been a director, you know, so it's, I'm happy that you're open to feedback, and I hope that you see how well it worked. Like, it went very, very well. So yeah, thank you for being open. Thank you for knocking it out. I opened it up. I was like, oh wow, this is gonna be great. Kids are gonna love it. Like, I already knew it. So
excellent.
Yeah, Definitely.
Well, email me, and if text me too. I call you Miss Richardson. She was like, call her Sherry. I was like, if I call her Sherry, she has to call me Toyin. I was like, she calls me Dr. Orunja. I'd be like,
all right, Toyin. I'll call you Toyin. Now we're off. We out of work now, so I'll call you Toyin. It's all good. Yeah, I do. I need to text you so we can have each other's contact information. I just been working via email, but congratulations on your house. That's huge.
It ain't done yet, but they stressing me out. They stressing me out.
That's how it works. I've gone through that process a couple different times, so it's just you got it. If you got a closing date, you're there. So kudos to you. That's really exciting. Definitely.
I look forward to working with you in the future. You can never hit me up too many times, okay? I promise.
All right, I got you. I'll reach out to you, especially when those results come in. I'll reach out to you. I'll hit you up, text you, call you, and let you know when it's coming out. I'll send it to you. But no, we are gonna do this again. Maybe in a different format, but absolutely. The kids love you. Kids love you. Our administrators love you. You're fantastic. I already knew you were gonna be amazing when I met you initially. So
thank you.
Yes, you look great. Very professional. Everything is wonderful. So okay.
Right. Well, you have a great day.
You too.
Weekend.
Thank you so much for coming by.
Okay. Oh, no problem. Anytime.
All right. I'll talk to you soon.